Of course. Well, first off, thank you to the SIA-IPhO organization for having me. It's great to be here and be able to share some of my background and experiences. So like you said, my name is Jessica. I am a first-year fellow in the Chapman Amgen Oncology Medical Affairs Fellowship Program. I guess going back a little, I attended UC Irvine for undergrad, majoring in pharmaceutical sciences, and then naturally pursued pharmacy further and got my PharmD degree in 2021 from the USC School of Pharmacy. I've been born and raised in Orange County, and I thought, I was going to go out of state, far, far away for pharmacy school, and then ended up not being too far in Los Angeles. And then, as fate would have it, my fellowship program allowed me to spend some time back home and family in OC, and now I currently reside in Los Angeles for the remainder of the fellowship.
That's great. Do you think what is one key experience that you had during school that made you want to pursue this route?
I think there have been a number of key experiences that kind of influenced my decision to pursue a career in industry. If I had to pick one out, I remember I was collaborating with a company working on a project that gave me the opportunity to work closely with oncology patients and patient advocates and put together resources that really helped voice their opinions, thoughts, and feelings around certain cancer treatments. And I think in this field where maybe you don't have as much of that one-on-one patient interaction, I saw being in industry, you're uniquely positioned to use your pharmacy background to help patients on a much bigger scale. And that is one of the many projects that opened my eyes to the impact I could have in industry. I think in addition to that, I've been lucky to have a few rotations, particularly in medical affairs, and I've been able to really grow and apply some of my skills in order to take scientific data and make meaning out of it. So my experiences in contributing to those projects has been very positive for me, very rewarding. And knowing that I'm having that influence on someone's treatment has been very rewarding for me.
Perfect.
Thank you for the thorough response, Jessica. So I guess I just wanted to ask, what does a typical day look like for you in the workplace? And I know it might vary day to day, but if you could just speak a little bit about that.
Yeah, so I think maybe before I describe what a day-to-day looks like, it'd probably be helpful to talk about the structure of the fellowship program, given that it's set up a little bit different from other programs. So this is a 2-year fellowship program, and the first 6 months you're actually involved in clinical training and what we call interprofessional experiences, but a major component of that are the clinical rotations, and those take place in the outpatient clinics, the academic hospital settings. And this entails working alongside the healthcare team, which includes the oncologists, nurses, NPs, PAs, and so on. And then the following year and a half after, the fellow transitions over to the company where they can rotate through different sub-departments under medical affairs, as well as any elective rotations that interest them. So when I describe a day-to-day, I'd say the lifestyle during the first 6 months of the fellowship is somewhat similar to a clinical residency in that, I'm working up patients, I'm making recommendations as it relates to their medications, counseling, just to name a few, but you also go on rounds for patients who are admitted to the hospital. And then, as a pharmacist, it's great to be by the side of the oncologist and serving as that resource. And so in addition to that, in that 6 months, you're also completing a majority of your teaching certificate. So that involves you being adjunct faculty, which is in collaboration with Chapman University. So you're involved with doing lectures, facilitating workshops, and serving as a preceptor. So then when you go to the company, you probably heard time and time again, the day-to-day doesn't look the same. And a large reason for that is because the nature of your projects really change day to day. And by that, I mean that, I guess to put it simply, you are working with your cross-functional teams on certain deliverables. And that could be, for example, working on materials for a conference. You could be doing a literature review, or you might be talking to healthcare providers about something. So, my day is usually filled with meetings or deep working sessions where I'm working on those certain resources, but day to day it differs because of the content that you're actually working on.
Okay. So you participate in many P&T competition, and your team were very successful, and you were in the first place and third place in some of them. Do you think what was the impact of the participant in the P&T competition? What was the impact of it in your success, in your career success?
Yeah, I think there are like a number of valuable lessons I kind of drew from competing in those competitions. One that stands out is it certainly taught me the meaning of quality teamwork. I think if anyone has competed in the P&T competition, they know it's a pretty big endeavor. You know, you're developing like a 30-page monograph and a 25-minute presentation. And I think it goes without saying that it really requires a lot of strong communication amongst the whole team. So it taught me how, as a team, we all can contribute our different strengths to put together, you know, this final product. But it also challenged me a lot in some of my weaker areas. And I carried those experiences with me now as a fellow, working on new teams all the time and projects that I'm not as familiar with. You know, for P&T, I'd actually attempted to compete my first year, and that wasn't successful, but that was actually a really great learning experience because I reflected on my mistakes and learned how to better prepare for the following year. And I think that was recognized when we placed in the local competition and then had the opportunity to compete nationally. So it was really great.
Yeah, I'm kind of in the same boat. I joined my P1 year and then we just didn't submit. We weren't really like ready for the workload and didn't really know what we were doing. But
yeah,
for
anyone who wants to compete, definitely get a head start prepare as early as possible. You know, you have other obligations too, so it definitely takes a lot of time out of your day.
Most definitely. So I guess for students who are interested in fellowships in oncology, what are some like key skills and experiences to hone in on, and like what would set these like, you know, students apart?
Yeah, so from my own experiences and now, you know, having been on the other side of the application process, I think being both well-rounded in your academic and your extracurricular areas is key in terms of how you present on paper and before the interview process. Into the interview process is kind of your chance to share those unique stories that have impacted your professional and personal interests in development. I particularly think like sharing stories of times where you had to overcome certain challenges, come up with unique solutions, and what the outcome of those solutions were are very impressionable to me. And that could be like, for example, in the context of a patient interaction that you had. You know, in oncology, it's really important to understand the patient experience and clinical decision making that goes behind a lot of the things that industry does. So I really encourage students to, you know, seek out opportunities where you can, whether that's an internship, research, volunteer work, taking on certain projects in your experiential rotations. But I also add the caveat that I think, you know, getting those opportunities becomes more and more competitive. So, you know, don't be discouraged if you don't land that internship or that rotation that you wanted. There are definitely other avenues you can take to show that you have interest in oncology and industry.
Great advice. What do you like most about your job?
I think what I actually didn't expect going into this job is the creative part of it. You know, there's like so much data that comes out every day, especially in oncology. And it's kind of your responsibility to be able to break it down, make it easy for people to understand. And that involves using kind of your creative side to it. And, you know, some of my projects now, I'm having to think of how we want to, like what colors we want to use, how we want to format certain slide decks or like materials that we create. And so it kind of like appeals to the right side part of my brain, and challenges me to think creatively about a lot of the projects we take on. Yeah, I think the easiest way is to get involved in your local and national organizations and attending those networking events. I think nothing really beats face-to-face interactions. It's one of the best ways to have like meaningful conversations with, experts in the field. But in addition to that, if you saw someone's role that interests you online or on LinkedIn, reach out to them, set up a one-on-one meeting, whether that's over coffee or over a meal. Don't be fearful to cold email or message individuals. I did that all the time as a student. People are really willing to take time to share any guidance and advice because they were in your shoes once. I think also another opportunity is attending conferences. That's a great place to network with, a group of people in the setting. It also gives you a platform to discuss, what's a hot topic in pharmacy, and you guys can share your thoughts and feelings about it. So another great place to really leverage your network.
So then what piece of advice would you give to students who are currently applying to internship or a fellowship position?
Yeah, one of my biggest pieces of advice probably even before applying to the internships and fellowship is building strong relationships with mentors. I certainly wouldn't be in the position I'm in if it weren't for the mentors I've had over the years who have years of experience in the field and can share their knowledge and little tidbits of what has shaped their career. But another piece of advice is that networking piece. Reach out to previous interns, fellows, managers, so on, and ask those specific questions about their role and the projects they work on, because the more that you do on your part to understand what the position entails, the better you can actually talk about, what ways you can contribute. And then in addition to, reflecting on your pharmacy career, I also really encourage people to think about their goals and accomplishments outside of pharmacy. I know some of my friends and I, when we were preparing for fellowship interviews, we looked up, top 100 interview questions and trying to prepare for those. And you'll notice that they're not only evaluating your technical skills, but also if you're a good fit for the team. So chances are you are more than qualified to fulfill that position, but adding that layer of your personality and your personal interest can really help you stand out.
Thank you so much for your time, and thank you with your busy schedule accepting to devote your time to our conversation. I'm sure that's a great source of information for students that like to pursue your career path. Thank you so much.
Thanks so much for having me.